So the commissioners were just wonderful and backed us, and now we have an annual No Stigma, No Shame Day, which is the third weekend in April every year. So we're very excited about that. We have lots of signs around the community. We do a lot of things in the school. In the schools, we're doing a lot in the middle schools this year leading up to this. And so that's one of the reasons we're here. And one of the reasons we're also here is to want to educate the community. And we brought in, be a part of the conversation. And Kristen, there she is. Kim's over there wandering around. He's our director. And a few other people, Kate, where's Kate? Oh, there she is. It's going to be part of the Appleman.
Kate Appleman.
Right. Sorry, I'm trying. Bob Lamb is here, and then we've got our Abby's Bakery family, the Wolf family, who are wonderful, and we talk a lot with them, work with them, and suicide prevention. So if you need to know anything about that, get resources about that. We're all about education, awareness, and resources. We're not a recovery house. We don't do recovery, but we do help people, point people the right way when we get emails and phone calls and questions and what do we do next and everything, and along with, again, educating the community. So we're hoping that people really start thinking more about this. Everybody will raise their hand when I say, do you know somebody, or do you know somebody who knows somebody that any of this has happened to? And you don't have to be adults, you can be kids. A lot's happening with the kids' parents now, and so we just want to educate the community about this. So that's what we're all about, and we've got Be a Part, who's going to bring a great conversation, navigating the maze of substance use disorder, of substance use and mental health, which is really important, and that's really what we get calls about a lot, like, what do I do next, where do I go, I don't know what to do, you know. So it's really, really, really important to know. I would just like quickly to introduce our commissioners that are here. We've got the board president, Jim Lee, who is here, Beth McNamara, Brendan May, and I think that's it for the commissioners. And if you'd like to get up and say a couple of words so quick, we'd love you to.
Sure. Hi, my name is Jim Lee. I'm one of the commissioners here in Springfield, and as Barb mentioned, last year at their urging, we established an annual No Stigma, No Shame Day for the third week of April, and this is the second year. So we understand, the board fully supports and understands that the work that stoAc and other folks like it do, helping shed the stigma and understanding the realities of mental health and addiction is really, really important. So we're happy to be part of that. And their organization, and Sue and Bob and Barb and all their folks, and they bring young people in and people that have had a loss that contributed to us. We really appreciate that work because it's really important to get that out and circle other people in that may be going through something. So the education is really important. So that's great. So we should all support that and be part of the education so that we can be a resource when there's signs of distress with other people. So again, thank you, and thank you all for being here.
So I think communities like this are just amazing, and I really respect Barb and Sue Crowther and the others who are with stoAc, so thank you for what you do. I so admire the work that you do, and thank you to Springfield Township. We were in this room previously with a district magistrate who wanted, when we were really at the height of the upswing of opioid use, and I just really appreciate when we have leaders in communities like yours who are willing to talk about things that are frankly very stigmatized and very challenging. And so thank you for having us, and I agree this is such an important topic. Also, we have some, you're going to meet somebody really special from Care and Treatment Center. We have materials from them, and Louis DeSanto, I think, might have stepped up with his talking right now. This is Louis DeSanto. He's from Care and Treatment Center. So he's got all kinds of information he can share with you about their wonderful organization as well. Full disclosure, my son found Recovery Care and Treatment Center. It's a rehabilitation center in the Reading area in Warnersville. So I'm really glad that we have a fantastic speaker from Care and Treatment Center today. Already said thank you, but really thank you so much. We actually planned on doing this in 2020, and then guess what? That didn't happen. So we're so glad to finally be here and talk about this important subject. You can follow up on this program. We're going to have Kate's slide deck, and lots of other resources and information on our website, conversation.zone/addiction. So now I'm going to finally tell you about the woman of the hour here. Kate Appleman is the Senior Director, for the moment, of Clinical Practice and Professional Development at Care and Treatment Center. Since 2013, Kate has been active in Caren's program development, supporting the development of evidence-based clinical programming for executives, healthcare professionals, attorneys, and those with an opioid addiction. Her areas of expertise include motivational interviewing, working with family systems impacted by addiction, relapse treatment and prevention, and men's addiction treatment and recovery. Please help me welcome Kate Appleman.
That's just where I'm recording.
Hello. Happy Thursday. My name's Kate Appleman. I actually took a new position at Karen on Monday. I'm the Executive Vice President of our Pennsylvania campus. And this is great. I just want to give a shout out to Kim and to Bob. The work that they do is absolutely incredible. I've known them for, I don't even know how many years. And the amount of people that they impact with the programs that they put together is incredible. And I just want to give you guys a shout out to the amount of people that you impact. Hence, they're a part of why we're here today. So we're going to talk a little bit about factors related to treatment and recovery as it relates to addiction and mental health. Because the two come hand in hand most of the time. Not all the time, but most of the time. And you might hear a little bit of that from Alana tonight. She's actually the real reason we're here. I'll just try to be quick so that we can get to her. All right, so just a couple things about co-occurring disorders. So you'll hear, when you talk about co-occurring disorders, we're talking about two things happening at the same time, right? So substance use disorders, when you look at characterizing them, they come in different levels. So you have a mild, moderate, or severe use disorder related to whatever chemical it is that you're using. So we'll talk about that a little bit. One of the questions that several of you had put out to Bob and Kim was around what comes first? How do you know if you're treating anxiety with marijuana? How do you know if the alcohol is creating a depressive disorder? Which comes first? How do you know? How do you tease them out and separate them? We're going to talk about that a little bit today. So when we talk about co-occurring disorders, you'll hear it sometimes labeled as dual diagnosis. Those terms are very much interchangeable. And we're talking about both substance use disorder and some kind of psychiatric disorder. So substance use disorder, again, there's different symptoms that are going to come with use, early recovery, and sustained recovery. And some of those symptoms are mental health symptoms that in recovery naturally just take care of themselves. And sometimes they don't. So we'll talk about a little bit what that looks like. So some of the most common psychiatric disorders that are co-occurring when it comes to substance use disorder, your anxiety disorders. So generalized anxiety, it's just a normal part of the fabric of your life that permeates all different areas of your life, isn't specific to one area. Social anxiety, obsessive compulsive disorder, mood disorders, thought disorders. We're going to talk a little bit about each one of those. In the room with us is actually Dr. St. James. She's one of our psychologists in our Philadelphia office. So she's going to keep me honest here as well, which I appreciate. The one thing that I do want to say is symptoms don't always equate to an actual diagnosis. Does anybody feel anxious? Anybody feel anxious at all this week? Anybody feel anxious without a diagnosis? Right? So sometimes stress happens. Sometimes anxiety happens. Anybody feel, when you think about feeling your mood shift downward, you think about feeling depressed, it's a little bit harder to get out of bed. And then something happens, you get this little like dopamine rush because you're excited to see someone, because you got yourself to the gym, because you ate something really good, because you had a connection, and then starts to dissipate, right? We have symptoms sometimes in mental health. It doesn't always equate to an actual disorder, right? Because if you think about mood kind of on the spectrum, as human beings, we're supposed to move on the spectrum. If we don't move on the spectrum, what does that mean about us? we're not in a position where we're fully experiencing life. If I never felt stressed or anxious, that meant that I never changed and I never took risks. If I never felt sad, that meant that I probably never really had a connection. We're hardwired to live on the spectrum of emotion. It's really hard to feel really happy and excited about something without being able to experience the other side of the coin. So experiencing the symptoms does not always mean diagnosis. What comes with diagnosis is enough of the symptoms over a long enough period of time. So any mental health practitioner will use the Diagnostic and Statistical Manual 5 to look at different symptom sets that will say, you struggle with depression, with a major depressive disorder. You struggle with generalized anxiety disorder. But it's enough symptoms over a long enough period of time to really look at a diagnosis. So as we look at prevalence, part of the reason why we're here today is because this is incredibly common. This is incredibly common. So when we look at the amount of adults, this is from SAMHSA, actually from this year, the amount of young adults age 18 to 25 that have both a substance use disorder and a mental health disorder, 13%. 13% sounds pretty small, but is it really, right? So is it really small? And that's both disorders coming together. Then we start looking at the percentage of people that, let's see, nearly 1 in 3 adults have either a substance use disorder or any mental health in the past year, and 46% of young adults had one or the other, right? So when you look at some of these statistics, to the point that we discussed earlier, this is something that's incredibly prevalent. It's us, it's our family members, it's our sons, it's our neighbors. So when we look at some of this is part of why we're here today. So these statistics show that it's important for us to be here. I'm not going to go over all of them. Individuals with substance use disorder, about 60 to 70% of them also have a psychiatric disorder. So I work right now in residential treatment. When I originally looked at that statistic, I thought, well, that's not true. That's pretty low. But then I also realized I work with people who usually have severe substance use disorders. But if you're looking at an outpatient setting, that number probably sounds about accurate. So when Dr. St. James is looking at doing evaluations and assessments at an outpatient level of care or a partial hospitalization level of care, that statistic might be a little bit more accurate. So this just really talks about the prevalence of both being true. I don't want to spend a ton of time on this. But let's talk about contributing factors. So why does this happen? When you look at the stigma that comes along with addiction, there's still very much a belief out there that if you knew better, you would do better, right? If you knew better, you would do better. How many times have you heard that, Alana, right? Just stop. Just stop doing what you're doing. If you were connected to your value systems, you would make better choices, right? You don't care about the people around you. If you cared about being a parent, you would stop using. If you cared about your parents, you would make different choices. And if you think about it, when I say that blatantly, it kind of sounds crazy. But how many times do we hear that? We hear it at family gatherings. We hear it in social situations. We hear variations of it on the news. When you think about the way that the news is reported, we hear that, right? So when we look at some of the contributing factors, some of the way that the foundation is laid is outside of our control, actually. Some of it, not all of it. So when we talk about what contributes to co-occurring disorders, mental health, and substance use disorders, we first start with genetics, right? So when we talk about a genetic predisposition, that means that addiction or mental health runs somewhere in our family, right? When you think about depression many times is less dopamine in your system than the normal person. Now, when you're born, do you have control over how much dopamine is in your system, right? So when you think about that, the predisposition, a lot of this is really based on neurochemicals more than anything else. And when you think about what happens to dopamine and serotonin, your happy chemical, those things are impacted as a result of mental health. And then, by the way, when you start putting substances in your system, there are ways that very much impacts your dopamine and your serotonin, right? because those pieces get influenced when you're putting chemicals in your system. And when you start to come down from chemicals, your serotonin and your dopamine buckets start to dissipate. So if you ever think of somebody who uses stimulants and wakes up the next morning, how do they typically feel? They don't feel all that great, right? Because they dumped all their happy chemicals last night when they were using, right? So then all of a sudden you see somebody with this mood dysregulation and you can't quite put your finger on what it is. But then you start realizing what chemicals they're using and it all makes sense, right? So genetics play a role in it. Family plays a role in it. When we think about how we learn about emotions growing up, there's certain things we do and don't learn about emotions. It's just, that's a reality of it. The way that we learn about coping with day-to-day stressors, much of that you get initially from your parents. Now, some of it is spoken, right? Some of it is the spoken. When you're sad, we should talk about it. When you're excited, I want to share that with you. And some of it's unspoken, right? I grew up in a very large Italian family. The loudest, squeakiest wheel got the attention, just the way it goes. There were so many of us in my family, like a lot of people in my family, right? So when you think about the unspoken truths, anger was this emotion that was okay for men, I don't mean to make it about gender, for men to feel in our family, but sadness, you didn't talk about that, right? When I think about the way my grandfather raised the next generation, and then what we learned about feelings, there were certain ones that were okay and certain ones that were absolutely not okay. So just thinking about some of those pieces that kind of play a role in where we come from and where we're going. Life stress. So if you think about your ability to manage stress, we talk a lot in treatment about the concept of resilience, right? Resilience is this ability to bounce back. Now you can imagine a majority of the people that are in treatment need an ability to bounce back, right? We do too. We do too. When something happens in our life and there's disappointment, when something happens to a relationship, when there's a crisis. Anybody been through a crisis recently? Probably talking in the right room, right? So if you think about your ability to manage stress, we learn that in a couple of different ways. We learn that in the way that we grew up sometimes. We learn it in the amount of resilience that we have, which is not something we're born with. It's almost like a muscle that we develop kind of over time. All of that plays a role. I'm going to talk about ACEs in a little bit. Loss. Loss can play a significant role as one of the contributing factors. We do a lot of grief and loss groups and have spiritual counseling at Karen for a very specific reason. You can imagine that if somebody comes in with an opioid use disorder, they probably know a ton about loss in ways that we don't even want to imagine. So when you think about loss has so many different examples of impacts that play a role in a lot of these pieces. Stress can actually trigger genetic factors. So I may have a genetic predisposition to depression because depression runs in my family. I may not experience it until I get to the point where stress occurs and I don't know how to deal with it, right? So I think about my family system growing up. I had the death of my dad died when I was younger, right? And depression just kind of runs in my family. That doesn't get triggered for me until I have no idea how to deal with that. We hear that story all the time in treatment, right? So when we look at some of the contributing factors, these pieces absolutely play a role. The other thing that I'll talk about is there's this concept related to ACEs, adverse childhood experiences. And what it talks about, has anybody heard of ACEs before? Keep your hand out, Pam. Okay, so some of you have, right? So when we talk about ACEs and adverse childhood experiences, there's certain experiences that we go through growing up that put us at a higher risk to develop a substance use disorder, a higher risk to develop mental health issues, a higher risk to develop other physiological issues. I think I have a list here, hold on. All right, so when you think about adverse childhood experiences or ACEs, 1 in 3 adults have at least one adverse childhood experience. 1 in 6 adults have had at least 4. And I'll go over what this looks like. I want you guys to think about that. Individuals who experience 5 or more adverse childhood experiences are 7 to 10 times more likely to struggle with addiction. Now, look at the list, right? Now look at the list. So you think about depression. Depression felt by self to felt in the household. Alcoholism, being able to see alcoholism. So if you look at alcoholism in the family, there's a lot of spoken and unspoken rules and relationships that come along with alcohol. If I live with Camille and anytime she gets stressed, she drinks. She feels lonely, she drinks. It's Tuesday and raining and she drinks. All of a sudden, when I'm stressed and I'm lonely and it's a rainy day, what do you think I'm gonna do? I just learn how to do that, right? We learn from what we're around. Smoking, suicide attempts, other illicit drug use, if you have liver disease, poor work performance. So when you look at any of these pieces, these play a role. If I have enough of these, it plays a role in what happens with addiction and mental health, right? So some of these pieces are important to really think about. They're important to really talk about. They're important also to think about as we look at a recovery process. Some of these things naturally reduce in recovery, and some of them we have to work hard at looking at them directly to reduce them in recovery. But the beautiful thing about recovery is you have the ability to do a lot of it, right? When you're in recovery, there's so many things that you can do that you weren't able to do before you got into recovery. When we look at mental health and we look at substance use disorder, again, there's so many aspects of it that it's chemistry. So if you think about the shame that comes along with addiction, think about the shame that comes along with addiction when it's actually about chemistry. How much control do you have over chemistry, right? So when you think about any chronic disease, you think about addiction, you think about heart disease, and you think about diabetes. The stigma isn't attached to the rest of them when, oh no. So as we look at some of the examples of the chemicals that are impacted by addiction, you think about serotonin. Serotonin is that happy chemical, the chemical that helps stabilize mood, right? Dopamine. Dopamine is a chemical that is released related to the reward system, right? Dopamine is one of the biggest reasons why doing drugs feels so good. Because when you're using, your dopamine levels increase, which is that feel-good chemical, and all you want is more. So you hit, 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 hit. Now what ends up happening is you will have a normal kind of level of dopamine, and your normal level may be different based on genetics, but you have this kind of normal state. When you use, your dopamine increases, but when you come back down, it goes a little bit under what that normal line is. That doesn't feel all that great. So what do? You use again, which gets you a good enough feeling, but it never quite feels the way it did the first time. And then what happens? I come even further down. And then I come further down. And you ever meet somebody who uses just to feel normal? That's why that happens. It's chemistry, right? It's chemistry. If you think about oxytocin and vasopressin, Hallmark makes billions of dollars every year off of those two chemicals alone. That's the feel-good bonding chemical. It's the chemical that gets released. Think about your favorite person in the whole wide world, and think about seeing them and getting this great big hug from them. Think about, anybody have babies around here? Yeah, me too. Think about that feeling of looking at a baby. Oxytocin, vasopressin, billions of dollars Hallmark makes off of it. What happens with ecstasy? You dump all your oxytocin and vasopressin at all at the same time, and I love all of you, right? If you think about those chemicals and the way that they're released in the use of benzodiazepines, same thing. It's chemistry. So when you look at the amount that's released when I'm using, why wouldn't I want to do it again? And then all of a sudden you're in this position where what addiction is really about is this battle between limbic system and prefrontal cortex. Your limbic system says, feel good right now. That felt good, do it again. Exactly. And your prefrontal cortex is the part that says, why don't you hold on a minute? If you use your rent money again, they're gonna evict you. And your limbic system says, just do it anyway, right? And you ever watch somebody and you wonder, like, how did you make that decision? It's kind of like going to the gym and the muscle that you're using over and over and over again, aka the limbic system, is the strongest muscle because you've been using it the most, right? So what happens is you look at people and you're like, how could you even make that decision? But if what I'm lifting is the limbic system, the part that says hit, feel good, feel good, feel good, and I'm not using my prefrontal cortex, like my good decision maker, the one that says like, hey Kim, stop, reflect, and then respond. Maybe you should consider not using your rent money. All of that is prefrontal cortex, right? It is your brakes and your steering that tells you how to live life in a responsible way. It's chemistry, right? We look at addiction sometimes in such shaming ways when it's chemistry. So I just want to be clear about that. And what ends up happening is when you start using chemicals and you're messing with your levels of serotonin and you're messing with your levels of dopamine, sometimes that looks like depression. Sometimes that looks like anxiety. Sometimes those pieces end up being standalone pieces, not even related to addiction, right? That's when you look at being in treatment and maybe possibly going on an antidepressant, and then maybe a year later you work with your healthcare professional to try to go off, and it's not going so well. That's okay, maybe go back on, that's okay. But thinking about the ways that they interact. All right, where am I? What is happening? Okay. So self-medication is when you look at this kind of short-term solution that ends up at times relating in dependence, right? So if you have somebody who has, an anxiety disorder, enough symptoms that create an anxiety disorder, what's one of the medications that people get prescribed when they have an anxiety disorder? Anybody? Valium. What else? Xanax. Lexapro. That's not too bad of a one, right? Lexapro's pretty good. But your benzodiazepines, your Ativan, your Xanax, your Valium, a benzodiazepine, right? So what can end up happening is if there's a part of you that's using medication, maybe not as prescribed, or maybe you are using it as prescribed, but you have continued to increase the dose, sometimes with a medical provider, and now you have a physical dependence on it. What ends up happening is because benzodiazepines have a really long half-life, you end up in a position where sometimes you have what we would call rebound anxiety, where your anxiety on the medication actually ends up getting worse over time because your body has now developed a tolerance to it. So when we talk about this idea of self-medication, that's absolutely a part of it. Psychiatric conditions sometimes can be worsened, many times can be worsened by substance use disorder. So let's talk about marijuana just for a second. Marijuana is shown to play a really integral role in some physical issues. If you think about some of your seizure disorders, if you think about some of your feeding disorders, some of which come from things like going through chemo, right? There's a place for it, right? I'll say that out loud. There's a place for it. It can be used effectively as a medication if in the right dosage and in the right way and for the right reason. I think part of what's happening is, and what we see in treatment, and Camille could probably talk about a lower level of care, what we see in treatment are people that are using cannabis in high potency, that their anxiety is actually getting worse as a result of it. The depression is getting worse as a result of it. So what they're using it for is actually making those pieces worse. I'm somebody who, I very much believe in research, right? If research tells me it's good, I'm definitely gonna look in that direction. And I'll give you an example of it. I've been a therapist for a long time. I think I've been at Cairn 20 years. When I first started at Cairn, you were abstinent, right? If you were coming off of opioids, they might give you Tylenol and put you in a room and say, we'll see you in 5 days, right? Now, as medicine has continued to advance in our field, anybody ever hear of Vivitrol, right? Has anybody heard of buprenorphine, right? So when you look at the use of anti-craving medications, the goal of them is to turn the volume down on craving so that therapy works. To turn the volume of craving down so that when you go to a 12-step program, your leg might stop shaking enough for you to sit still and listen, right? That's the goal of it. So when you look at some of these pieces, when you look at substance use disorder and the role that it plays in psychiatric maladies, there are many times when we're using substances to try to self-medicate the symptoms that are coming as a result of mental health issues. So we know those pieces. What else do I want to say? So when we talk about this diagnostic quandary, look at the symptoms of cannabis withdrawal. Look at the symptoms of alcohol withdrawal. So the amount of times that we hear the story of a man brings his partner into treatment and he says she's been on antidepressants and they're just not working for her. And you start asking, well, how much does she drink? And he says, well, she was drinking about 2 glasses of wine a day, but over the past year or so, it's gone up to a bottle and a half, usually 2 on the weekends. Why isn't her antidepressant working, right? Because she's drinking a depressant. So when you think about some of these pieces, it's hard to kind of separate them at times. The other thing that ends up happening is with alcohol and benzodiazepines go into very similar receptors in the brain. So you can have somebody come in and say, I watch my wife, she literally drinks 1 glass of wine and she is like snookered. How does that happen? Well, what kind of medication is she taking? She tripled her Valium. So when you look at it, there's this cross tolerance that ends up happening, right? So all of that plays a role, and what does that look like? It can look like anxiety, it can look like depression, it can look like overreaction or numbness, right? So when we look at some of these elements, sometimes we don't know what people are using. You know that their mood's irregular, you know that they're not consistent, you know that they may not be dependable, they don't show up the way that they want to show up, but you can't quite put your finger on why. So can you imagine how some of these look like a mental health disorder, right? Because so many of the symptoms of withdrawal play a role in looking very much like a mental health disorder. So when we talk about assessment, there's a couple of things. When you think about a comprehensive psychological evaluation, what Karen does is we do it up front in the first 5 days of treatment. Some of it is to identify where are we, where should we start to reduce the symptoms enough for the next level of care to work. And sometimes when people come into treatment, it's really hard to get a really good picture on them when they're going through alcohol withdrawal. When they're going through opioid withdrawal, which looks just like depression, probably bipolar, it looks like a lot of different things when you're going through opioid withdrawal, right? So starting with a really good assessment and starting to look at what medications are we talking about that might actually positively impact the withdrawal process, right? That's a piece that is huge. First things first, safely withdrawal. First things first. We also look at different aspects of collateral contact. Sometimes the story that you come to treatment with may not be the same perception as your family, as your therapist. We look at biometrics. Sometimes your body tells a different story than what you tell. Is that the best way to say it, right? That's a nice, yeah, maybe your body tells a different story than how you kind of remembered it. So when we look at trying to understand it from a holistic approach, there's a lot of different ways that we need to get our information. So then the question becomes, is someone self-medicating another problem? Are there substance-induced symptoms, which if you think about it, if you stop using the chemical, the symptoms are not going to go away immediately, right? Because the brain is one of the biggest organs that needs time to heal, not just the liver. The liver is usually the first one we think about. But there are times when the mental health symptoms, they just go away. They end up just going away, and sometimes they don't. What I do know is if you have symptoms in early recovery, any way that you can get support with them in a healthy way is really important. So if you have somebody that maybe their depression is going to end up clearing up, but today, 2 weeks into treatment, they're struggling with depression, we don't care why you're depressed. We want to treat your depression, right? We don't care if you're depressed because you're drinking alcohol. We don't care, did the depression come first? Was it the alcohol? Right now, you're struggling with active symptoms of depression. We're gonna treat that. So there's so many times when family members ask the question, well, which one came first? Sometimes it doesn't actually matter. Sometimes in that moment, when we look at assessing first things first, we look at taking the mood and mind altering chemicals out in a safe way, and then we assess where you are medically, because we need to make sure you're medically okay to do the rest of the work. And then we start going down and looking at psychological symptoms. And are you ready to change? And what is your risk to potentially go back to use? And how's your environment? How's your home environment? How's work? What does that look like? What are your supports around you? And we go bit by bit to really understand kind of where to start. I want to talk about this whole concept of when we think about treatment. Part of when we think about recovery, treatment can be an aspect of recovery, but isn't recovery in and of itself. We're a part of the story. We're not the whole story. We think about this goal of going from crisis into struggling, into surviving, and then thriving. My first job at Karen when I was 19, I was a receptionist in admissions. Welcome to Karen, that's what I did. It was one of the best jobs I've had up there. Because if you talk about seeing people at their worst moments, while it was scary at times, I got to be a part of that. You see them at their worst moments, right? So when you look at this piece, it's not just about our loved ones who are in crisis, and then we want to move them to just struggling, and then move them to let's survive for today, to thrive. It's us too. As family members, it's us too. So there are times when people get into recovery where they stop using and they get out of the crisis and they just continue to struggle. Anybody can relate to that? You're out of the immediate crisis, but you continue to struggle. Part of what we want to look at is not just adequate treatment, but adequate support that people like Kim and Bob put into place as one facet to help people move from struggling to surviving. I'd much rather survive than struggle, but my goal is always to thrive. You ever have days where struggle is the best, or surviving is the best you can do? Part of the reason why you chose to come here, you guys probably had really long weeks. It's Thursday night, it's been a long week. Part of the reason why you choose to come here is because you want more thriving. That's what you want. And we get to hear a story about that. I told you I was going to be quick. Here, it's going. All right, so here's what we struggle with. This is sometimes the elephant in the middle of the room, what we're going to break into small groups and probably talk about a little bit. All of these pieces are the things that we end up struggling with, right? So whether our loved one struggles with addiction or mental health, or usually a combination of both, what happens for us in the midst of all of it? I treated a family once where the husband was a stockbroker on Wall Street, and he, usually the work is the last thing to go. And he got to the point where he was so dysfunctional in active addiction that he couldn't even make it to work anymore. He told his boss he was sick. He told his wife he was at work, and you can imagine where he was, right? So I ended up treating her as a family member, and one of the things that we talked about was, in the midst of his active addiction, he's using all these chemicals and numbing, right? He's numbing and numbing and numbing and numbing. What is she doing? She's going through this with exposed nerves. Anybody relate to that? And many times, being the family member of someone who's struggling, we have the same symptoms. They struggle with fear, so do we. They don't know how to manage their emotions, neither do we. They're afraid, so are we. They're afraid to talk about reality, so are we. They're afraid of people judging them, so are we, right? So the fact that you're here and willing to have a conversation about it, we're in a position where how do we go from surviving to thriving? That's why you're here today, right? So what we find is we look to move from being a human doing to an actual human being. For so many years, many of us have worked really hard to just keep it together in a way that made sense, right? And if you look at part of the recovery process, it's shifting from one to the other. It's shifting from secrets to openness. It's making this shift so that we're not just a human doing, but we become a human being again. That's part of family recovery. It's really important to talk about prevention. I think that's important. We also need to know about detection. How do we know what's happening? How do we have a good diagnosis to make sure that we're supporting people in a way that makes sense? And then how do we get people the treatment we need? Healthcare professionals are really successful in recovery because the two people that you don't want high are your physician and your pilot. So they do recovery really well, right? But the reason why they do it really well is because they believe you need an accurate assessment and adequate treatment followed by monitoring. It's that simple. And they're very prescriptive in the way that it goes. So think about that when it comes to treatment. All right. What I will say is when you think about when you should ask for help when it comes to addiction and mental health, the reasons why you ask for help are actually the same. It's because there's a loss of control. Is there a loss of control with depression and heroin use? For sure. When you look at a failed attempts to manage it on your own, you try really hard to talk your way out of your anxiety, but it's just not working, right? How many times do we try to do that, but it's just not working? So really thinking about these are the reasons why someone would seek help. Mental health and substance use are very, very similar. So the reason why we would ask for help are very similar. I'm going to actually pause there for a minute. And I do want to talk about this statistic because Kim mentioned something earlier that makes me think about this. At Karen, we talk a lot about this idea that recovery isn't just possible, it's actually probable. When you think about 7 in 10 people who ever had a substance use disorder identify as being in recovery. 7 out of 10 who've had a substance use disorder identify as being in recovery. That feels pretty hopeful to me. 2 in 3 adults who've ever had a mental health issue consider themselves in recovery, right? So part of recovery is being here, having the knowledge that makes sense to have, having the conversation, asking the questions, and making the connections. That's why you're here today. That's why you're here today. That's what I have. This is Lewis. He's in the back. He had a baby. He has a baby. He's one of those people that doesn't sleep in the back. He's one of those people. If you have questions, we're here. Let us know. I want to save time for Alana and her story. And I just appreciate being here with all of you.
Hello everyone, my name's Alana. I'm a teacher, so you would think I'm like good at public speaking, but it still makes me nervous. Like, oh my god. So I'll just picture you guys as like 8 and 9-year-olds and I'll be good. But yeah, so kind of qualify myself to be up here. I am a recovering addict. I got sober December 20th, 2020, so right in the middle of COVID. I got sober at 18, I got sober very, very young. I've always struggled with mental health issues my whole life. I still do. Something that over time I've been able to cope with a little bit better. Really find the resources to help, kind of take the edge off a little bit. But yeah, I was gonna start when I was a kid. So at first my life was pretty normal. I have my mom and my dad got married because my grandma is very Catholic and they had a baby out of wedlock. So they were like, oh my God, you have to get married now. So they were forced to get married, forced. My mom definitely had a choice, but they got married. Had my sister, and then shortly after had me, and I was always the labeled difficult child. Always that difficult child who gave everyone a hard time. Yeah, so as I got a little bit older, my parents eventually split up. Found out later because my mom cheated on my dad. My mom is a hardcore addict. Opioid addiction went, pretty deep. She also has some pretty severe mental health issues. She had borderline personality disorder. So I would say nothing she said is ever the truth. It's really hard to believe her. It's really hard to understand the reality when you're with her. Somehow this divorce was very, very, very messy. It lasted 5 years. The divorce lasted 5 years. My dad lost custody of me somehow. My mom was very, very abusive and a really good manipulator and a really good liar. And, I always say, sadly, court's always on the side with the mom. So my mom got full custody of us. And I was placed into her home, which was just a disaster, right? Like she's an addict, she's, you know, using, she was never a present mom, she was always, you know, she was having a hard time managing her own life, which looking back, like I have some understanding and I have some forgiveness for her because I can't imagine, you know, I mean, I guess I can imagine, I am an addict, I know what it's like, I know what it feels like. But living with her, you know, I was a difficult child because I was always the one kind of like putting out the truth. Like I would talk back to my mom. I would be like, you're like, what's happening right now? You've been sleeping all day. I don't know where you've been. Like, where have you been? I missed you, you know. And I really appreciate you guys talking about like, you know, the ACEs and stuff like that, because I definitely had that. I had a very hard childhood. I'll try not to cry about it, but since I started trauma therapy, I've been like very emotional all the time, which is good. I almost have like feelings tied to it, where for a while I didn't. But my mom was very, very abusive. She just didn't know how to handle me, and often ended up in, you know, a lot of physical abuse, a lot of verbal abuse, you know, being put down, being told that, you know, I'm not good enough, I'm unlovable, my dad left because of me. And, you know, I honestly think that's worse than the physical abuse. Like, I can almost tolerate that, but the being put down all the time, I couldn't. And I always like to kind of touch on that in my story because I think that's almost what really set me off. Like, of course I'm predisposed to it. I have the genetics. My whole mom's side of the family has like addiction running through it. And then you have that early childhood experience of just like significant trauma. You know, I never felt normal. I would go into school, I would be like, I would look at other kids, like, your parents don't treat you like this. Like, I don't know how to function. I don't know where my dad is. I miss my dad, but I'm being told that's because of me, because I'm awful. Imagine being 8 years old and being told that, you know. I look at my little third graders and I'm like, so much healing for me now. It's very healing for me. And eventually, you know, caseworkers are getting involved. They're searching my mom's cabinets. I'm starting to put pieces together. But what I would do, how I would respond to it was that I would always get very, very angry. I would explode. I'm a big exploder, right? So she would, you know, abuse me physically, you know, lock me in closets, you know, get really brutally physical with me. I'd have to go to school with like makeup to like cover up the bruises. And I would just get held back. Because I learned that if I fought back, that she would stop, right? So, you know, I like to touch on that. I like to talk about that a little bit because I still struggle with a lot of PTSD to this day, even in sobriety. It's something that, you know, I'm recently really starting to explore because it took me getting sober to, and like staying in sobriety for a little bit to really unpack that. So eventually I get put back into my dad's house. The caseworkers are coming in and out. They're starting to see the truth. My mom's a really good manipulator and a really good liar, but eventually you start seeing the holes in her story. And my dad gets custody of me again. At this point, I'm so used to living in chaos. I'm just used to, you know, the late night trips to CVS, to all the different CVS's in Jersey, so my mom could get her perks. I'm used to just, you know, her never being there and taking care of myself. I'm not used to the stability. So I go to my dad's house. I love my dad. He's a great man. He's got his issues. You know, I think I traumatized him enough. My mom traumatized him enough, but I love him dearly. He's very rigid, very stable. The way he copes with things is rules, structure, abide by them, morals, values, and a lot of religion, right? So I go there. Obviously, I'm on the wall of it. I'm very uncomfortable. I'm like, what? You're telling me to do the dishes? Like, I'm used to them piling up. I'm used to a really messy environment, and then I would start freaking out at him, right? Because I had all this pent-up anger from how I was shooting at a kid, and like almost all the pent-up anger because it's hard for a kid to understand like what happened, where your dad went, and why your mom treats you like this. At this point, my dad got remarried. He has 3 kids, Gabriel, Matthew, and Luke. I call them the little Bible army. And they're baby babies. And there's a lot of jealousy there too, you know, like, oh, now you start a new family. There's a lot of resentment building. I'm angry. I'm just a very angry person, which today I don't really seem like it, which is really weird. I like look back on this and I'm like, huh, it's interesting. I feel like a totally different person. Definitely still come up though. Especially when I'm driving, especially in Philly, especially on my way there. And, you know, I don't know how to cope with life. And I've been put in therapy for a while at this point too. And I know how to work therapists pretty well, like pretty well. Or so I thought. I mean, once you go to like treatment centers for addiction, you're like, they were like, no, absolutely, I know what you're doing. So I'm like working these therapists, and I I'm doing my coping skills, like journaling and different things, but it's just not clicking for me. So the first thing I started doing is I started self-harming. That was my first thing. That was how I escaped myself. It felt good. I got that release that I needed for so long and what I was looking for. And I got that like very content feeling. That's what I chased in my addiction too, just that feeling, just being okay. My dad eventually found out, poor man, I like traumatized him with that. And I've been in and out of psych wards a lot too, especially as a kid. I tried killing myself in 3rd grade, which I always glossed over a little bit. I was always just trying to escape reality. I just wanted to get outside of my body. I didn't want to be in my own skin. And I'm sorry, this is like a lot of hard stuff to talk about and bring up. Every time I share my story, I'm like, jeez. So I went to the psych ward again and again. So I'm working the therapist. I'm like, I don't need this. Like, I'm fine. I know my coping skills. I know like the buzzwords to use in therapy. And I tried to eat better about that. So I find eating disorder. I struggled with that for a long time. Even to this day, I still struggle with it. I always find that one like a really hard one. You need food. It's not like drugs where you can just be like, oh, you have a program for it. Special eating disorder was in treatment for that for a long time. And then, I went inpatient, got pretty severe. And, like I almost died. And it was pretty scary. And yet again, like traumatizing my dad and traumatizing my whole family. Then after that, I finally found drugs. I knew about them, but I was always like, I gotta stay away. Like, my brother's a heroin addict. I can't go there. I've seen him overdose. I can't do that. I can't be like my mom. That was always my biggest fear. I don't want to be like my mom. But I started smoking weed. So I was like, it's pretty normalized. And I'm a teenager. I just entered high school. Everyone smokes weed. But not everyone got the feeling I got. Once I smoked out of a paper bag. It was a really teenager experience. But I felt what I've been searching for in the self-harming eating disorder for the first time ever. I just felt that complete control. And for the next 4 years, I chased that. And it was weed for a while. I started, I was like a hippie girl, starting psychedelics, which all new things. You're talking about, when you do acid, when you do ecstasy, that crash the next day where you're like, I feel awful and I need more. I need more again. And like I mentioned, I'm living with my dad, and he has 3 little boys. They're babies. And I'm being reckless. I am high all the time. I start really reenacting my trauma from when I was a kid. That was my big thing, is that chaos. I sought out that chaos. I'm gonna take a deep breath. I'm talking really fast. I'm a fast talker, my goodness. I saw that chaos, and I reenacted my trauma, and I just wanted what I had when I was a kid, that feeling again. Even though it was so chaotic, it was so traumatic, it was so abusive, that's what felt like home to me, was that chaos. I started sleeping around a lot. I was very hypersexual. I'm sorry, it's a little awkward, but that was one of my big things. Was I was very promiscuous. I was a big risk taker. I would go out every night. I would sneak out, run into people I'd never met before. The next morning I'm like, where am I? What have I done? What have I been doing? What did I try? What did I take? I didn't know. And my addiction really progressed. Eventually, my dad, I was seeing I was seeing an eating disorder therapist, but at that point she's like, I can't help you anymore. And I went to, I don't know if you guys know this Ethos. I went and saw a therapist. Her name's Lizzie Lopez. So to this day, I love her so very much. And I started seeing her, and that was the only therapist who was like, I see right through you. And I met her, she was pregnant. She was 8 months pregnant. I was like, you don't know anything about addiction. What do you mean? What do you mean you know what I'm doing? You don't know anything. You're pregnant, and I'm 16. What are you talking about? And she sends me back to treatment. 2 months later, she's like, all right, you gotta go. I can't. You're gonna end up dead. You're gonna end up, I wasn't being safe. you know, like I was on the track for my demise, which is almost what I wanted. Like I didn't expect myself to live 21. I didn't want to. Life just felt too hard. So I go to treatment. I go to Newport Academy, all the way in California. My dad's like, you gotta go. All the way across the country. I can't do it anymore. You know, he's had many interventions with me, and I just don't care. And like you were saying, you know, the whole idea of my dad would always ask me, like, why do you do this? Do you not care about us? Like, what? You don't care about your brothers? Like, why? You can't stop. I'm like, I can't stop. I can't. Like, I don't know why. Like, there's some points where I did. I genuinely wanted to not do what I was doing. But I was still doing it. So I go to treatment. I don't want to go to treatment. I was there for a good time. I mean, it was California. I was like, outside. I was like, nice, sunny. I was like, this is great. It's like a little vacation. I learned about all these drugs. I'm like, okay, I'm gonna do more. Then I get, they call it June, where you get kidnapped in the middle of the night and they take you to, they took me to a therapeutic Christian boarding school. And so I always say, like, I think that's the best, I think I needed that in that moment, right? Like I needed that. I needed to be in a safe environment where I wasn't going to get hurt. And yeah, I didn't, like I learned a lot, but I wasn't ready. I didn't see myself as ever being sober. I didn't want to. I just didn't want to. But I wanted to appease my parents. It was like very conflicting. Like I didn't want to get sober, but I saw all these reasons to get sober. I saw my parents and my family. I saw how much it was hurting them. I saw how like I remembered all those fights I had. And yeah, so I come home. It's March of 2020. COVID had just hit, and I come home. We're on lockdown. I'm back with my family after a year or so of treatment, a little bit less than a year. And I tried so hard to stay sober. I really did. I was like, I know I need this, at least right now. Like once I go to college, it'll be fine. I can party there. But right now, I need to be sober for my family. And not even 2 weeks later, I'm in the woods with a random guy taking Adderall, and no clue what just happened. I come home, and it's just game over from there. But one of the conditions my dad made with me was that I stay sober. That as long I could stay in his house as long as I stay sober. And he wanted so badly to keep me there after I relapsed, but I told him, I remember telling him, I was like, you just have to like let me go. Like, I don't want to keep hurting you. I saw how much I was hurting them. And it still makes me really emotional to this day too, because I mean, it was one of the most heartbreaking conversations. I can imagine being on the other side, like seeing your daughter just be like, I have to go. And he let me go. It was a big fight, and I moved back in with my mom, which, you know how I grew up, and never really got any better. I don't know why I wanted to go back there, but I always wanted to go back there. Saying I miss my chaos feeling. I really wish I could tell you what happened in those like next 8 months, but I don't remember. Like I was high all the time. But it got worse, and I kept getting deeper and deeper into my addiction. I kept progressing to worse things. Eventually, towards the end, like I'm starting to steal my mom's perks, and that turned into a hot mess. But luckily, it didn't last that long. But it was dark, and I started really sacrificing my morals and my values and what I thought was right. I mean, I really did some down and dirty things. I keep getting kicked out of places, and my mom kicks me out, my brother kicks me out, which my brother's in recovery now, so I don't know why I thought it was cool with him. I was like, I thought I was convinced. I was like, I can fool you. Like, he was like, you's just like me. And I still didn't get it. Eventually, I'm homeless. I'm 18, no clue what's going on. Still sometimes have no clue what's going on. And yeah, at this point, I wanted to kill myself. I just didn't want to do this anymore. I was tired. I was tired of the hustle and tired of the grind. Tired of just always feeling like I needed more and more and more and more. And tired of I didn't want to use anymore, but I didn't want to get sober. So it's kind of like, which one is it? So I was like really heavily thinking about killing myself, and I've had suicidal ideations in the past, and at this point I was just gonna have to do it. luckily I forgot I had a therapy session that day. And she called it, my therapist called it car therapy, where I was sleeping in my car at this point, and she's like, look, I have this like treatment place for you. You can go to the Haven, or you can keep doing what you're doing, but I can't treat you anymore. Because she's like, I just can't see you continue your demise. So I tried for a month to get sober on my own, right? Didn't work. I was just like, all right, if I stop doing drugs, at least I'll pass the drug test, but if I start drinking, that'll be okay. So like, I'll just keep drinking and like do that. So, you know, I was a mess, but I eventually did make it into this recovery house. I don't know how. Thank God for the woman who ran that house. And that's my like sobriety journey begins, right? And you know, my sobriety journey isn't very pretty. Like, I can't say it was just like, oh, I came in and I was cured and I was fine and I was great. Like, no, I was not. So I moved in this recovery house, and you know, I'm one of those people that I need therapy with AA. So I work the program of AA. I'm sure most of us are familiar with it. But I also really, really need therapy at the same time. I'm definitely a dual diagnosis case. But for a while, I like rejected that. I was like, just like, I'm content with being just an addict or just an alcoholic right now, because I don't want to deal with the other stuff. And so I started doing the program of AA, and you know, my life slowly starts getting better. I don't say it wasn't like an overnight thing. It took a few years actually. It took like 2 years of sobriety until I was really like, okay, like I feel better, I feel a little bit better. That first year of sobriety was really just like that. You know, I'm trying to survive. I'm just trying to get by. I'm just trying not to get high day, right? And eventually it turned into like, okay, like I need something more. Like, yeah, I have AA, and I'm working a program, and I'm helping other people, but like what, like I need something more. So I'm still seeing a therapist at this time, and she's kind of like, you know, I've been seeing you for a year in sobriety, like, I think you still have mental health issues. I don't think that had anything to do with your alcoholism. Because I would just keep shrugging off. I'm like, oh, like I was just an addict. That's why I had those issues. So I started seeing a trauma therapist, and that did wonders for me. So I started seeing her, actually like not that long ago. I want to say it was like almost a year ago. And it was really been almost like the key to my recovery, to like really unlock a lot of stuff that you know, almost like the reasons I was drinking. You know, I do think I was drinking or using because I'm an addict and alcoholic. They do think it also really had to do a lot with my childhood. So I started really doing that inner child work. I started doing a lot of like EMDR to really process what happened to me when I was a kid. And I mean, it's been hard. It's a hard experience to do this. But it's definitely been really rewarding. I've also had a chance, I worked in a sobriety house, a recovery house for a bit. I don't know how people do that. I don't know how people do that. Oh my goodness. At least like I work with kids now, at least they're cute when they lie to you. But you know, I've really had the opportunity to help other people, which in turn like really helps me. It helps me realize like more about myself and more about, you know, kind of the person I want to be. I remember coming into this program and I would constantly be like, I was 18. I'm 22 now. I'm still not that old. But I was like, I want to be a bad bitch. Like, I really want to be like this like baddie, and like he doesn't take anything from anyone. And yeah, it's pretty cool because I honestly now am. It's like been an amazing experience. You know, through working in 12 steps at AA, I've created so many relationships with so many different people, and it's been such a rewarding experience. And you know, I have so many friends. In the rooms, and it's just like beautiful being able to watch them grow, and it's been beautiful being able to help other people out, because I never thought that way before an addiction. It was always about me, and I couldn't think of any other way to think. So finally being in the rooms and being able to like finally be like, oh, like I have to think of something else, and that like helps me. That's pretty cool. So I started helping other people, and it was really transformative. And I'm trying to think of other things. I feel like I always have so much to say, but my brain just goes so fast. That's why I talk so fast too. My poor third graders. Yeah, I mean, I've experienced a lot of pain and grief in sobriety. You know, you lose a lot of people when you come in, and it's hard. It's hard. You know, they say in AA, it's like AA saying, like, you need a suit for weddings and for funerals, and I see both, right? I'm a maid of honor at someone's wedding, and like I've been to plenty of funerals, and you know, it really reminds me of like the severity of this addiction. Like this is real, and I love how you guys are doing like a stigma thing too, because I think that's a lot of why I couldn't admit that I was an alcoholic for a long time, because I felt so stigmatized. I didn't want to be different. I already felt so different, like my sobriety journey hasn't like. I've had a lot of mental health issues. So I suffer with panic disorder, which has recently like alleviated a lot since I started trauma therapy. But I mean, it like affected my life so much. I couldn't do anything. I couldn't go out. I couldn't work. I couldn't function in society correctly. And you know, really with the work of my therapist and really diving into my like childhood trauma, even the trauma of my addiction has been like absolutely beautiful. Because bad things did happen with addiction. Like I wasn't like I'm a young girl going around doing God knows what. Like, of course, bad things are going to happen. Bad things did happen. And I struggle with just a lot of anxiety, which I think is why I talk really fast. Because I just get so anxious. And, you know, I work with kids now, and I mean, I've really seen an influx of how many, I'm going to check what time it is. Oh, it's getting late. I'm so sorry. I've really seen an influx of anxiety, especially in this new generation and this, like, COVID generation, too. And, you know, it's been amazing to be able to work with them and help them work through it, but it's also really sad at the same time. But I'm really grateful that I have an opportunity to like, you know, reflect on myself and to work on myself so I could better help another person. But I don't know, I feel like I should leave it at that, but I feel like I'm gonna be thinking, I'm gonna be sitting down, I'll be like, oh, I should have said this and this and that. But it's really nice to be here. I hope I did an okay enough job.
I just wanted to thank you. That was awesome.
Thank you.